Hello. Okay, good morning, everyone. Welcome to my section. So today, my presentation will focus on using computer-based feedback to help student nurses to improve accuracy of performing clinical operations. My name is Posen Huang. I'm currently an assistant professor working at the Department of Nursing at Dalian University, Taiwan. So during the presentation, I will go through several parts. First, it's the rationale of the problem of the statement. Second, I will briefly talk about OSCE, which is a standardized test for nursing clinical education. We'll talk about the test and the problems. And then I will talk about EOSCE. EOSCE is the electronic system of OSCE. I will talk about the possibility and the benefits. And then I will talk about the design of the study. Then we'll move to the data analysis section and then the discussion section. Okay, so what is happening right now in nursing education today? The society poses increasingly high expectations toward nurses. The nurse today, they have to face many challenges. So nurse is an active member of healthcare system. Nurses are the ones who active the clinical care to patients, and they are expected to evaluate patients' clinical condition and apply accurate clinical judgments to articulate the judgments carefully to other clinics. And also, nurses are expected to provide a higher quality of medical care for individual patients. Also, they should be fully competent and trustful for the patients and their family members, which is the end goal of our training. And the nursing education today facing many great challenges. First, most of the teaching conditions right now is still the traditional teacher-centered lectures as a primary method for diverse nursing background students. And this kind of instruction, this kind of pedagogy does not meet the need for preparing nurses to present the comprehensive skills across settings. It's very common that our nursing students today, they have difficulties to connect their knowledge to the real case in their workplace, which in a hospital or healthcare facilities. And then I'll briefly talk about OSCE. The full name for OSCE is Objective Structure Clinical Skills Examination. This test was introduced to nursing curriculum as an essential part to help students to integrate all functional knowledge they have learned in classroom and put into practice with simulated patients under supervision by professional nurse. And the exam looks like this. So they will have different stations, and each station will have the simulated conditions. So stations offer a controlled simulated working environment and consist a number of stations that evaluate particular clinical test. So each clinical test in each section, which you can see in the picture in different rooms, tests a particular clinical skill with time constraint and consists by a trained patient and expert. Benefits of OSCE. So OSCE enables student nurses to practice clinical skills under a controlled environment. It also provides an objective feedback for students to see their actual performance before they are moving to a practice setting. And mostly it makes student nurses well prepared and give them confidence before they encounter in complex and varied situation workplace. Also, it has many problems. Every time we run OSCE, it requires a great effort in time investment and high demand of human resources. Also, lack of timely and individual feedback to students' on-site performance. Also, it's lacking the consistency in terms of test objects. It's impossible to timely individualize feedback to help students to have more chance to practice skills. So we come up with a solution, which is EOSKI. As you can see on the picture, EOSKI improving the efficiency of examining students' clinical skills. It also providing timely individual feedback. And also it make it possible for timely individual feedback to see in the real time. So in the old times, every time we run OSCE, it will take maybe a week for students to receive feedback. And with this e-OSCE, they can receive feedback within like 5 to 10 minutes. And OSCE in my university, Darren, student nurse at Darren, they have to pass OSCE training before their interns in the hospital. There is a positive relation between OSCE and the rate of passing a national exam for registered nurses. Okay, so the study, next I'll talk about the design of the study. The present study would be a pilot study explores whether student nurses will utilize the electronic feedback to improve their clinical performance after they complete OSCE. The differences is student group E can check their performance and feedback immediately with an iPad app. Participants. So this time we have 42 college nursing students, and all of them were in college junior class and recruited from nursing skills and implementation course. Procedure. So during the first 6 weeks, students were asked to be familiar with the content knowledge. And started from week 7 to week 15, students were asked to practice OSCE training sections. During the OSCE week, which is week 16 to 17, students were randomly assigned into Group T and Group E. In week 18, all 14 students have performed 5 randomized selected clinical procedures as their finals. And you can see results from the table 1. So the independent t-test was conducted to assess students' previous knowledge to be learned clinical performance in table 1. And table 1 shows no significant difference between the group E and group T. T is 0.59 and P is 0.56. So existing empirical knowledge between the two groups. Therefore, students in both groups do not have difference before they receive the semester-long skill training. And the second table, table 2, the independent sample of analysis of covariance was conducted to evaluate students' clinical performance after they received different type of feedbacks, which you can see on table 2. Immediate electronic feedback, group E, versus self-reflection, group T. The results show a significant difference after excluding the influence of the pretest results, which indicate a positive effect on students' learning achievement. The results suggest student nurses who receive immediate electronic feedback could perform clinical performance more accurately by the end of semester. Then I'll move to conclusion. The timely feedback students have received after OSCE has a positive effect on helping student nurses to confirm the correctly performed clinical procedures and correct the wrong performing ones. The accuracy of clinical performance has been improved in their following practice. Thank you for joining our presentation. Again, my name is Person Huang, and my partner name is Ying. Our contact information is listed on the PowerPoint. If you have any further questions or comments, or you would like to talk with us, please contact us. Thank you. Bye.